Medicare supplement versus Medicare Advantage when it comes to customer satisfaction. You might be surprised. So stay tuned to find out more. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices. So if you need help, and you need help enrolling in a plan, then reach out to me. You will see the contact information towards the end of the video. And before we get started, if today is your birthday, then happy birthday to you. As Voltaire said, God gave us the gift of life. It is up to us to give ourselves the gift of living well. I also want to point you to my video, Why Some Insurance Agents Don't Like Medicare Advantage. These two videos kind of go together. Let's go into customer satisfaction when it comes to Medicare supplements versus Medicare Advantage. One of the things that's important to know is now more people are on Medicare Advantage than they are on original Medicare plus a supplement. 50% of Medicare beneficiaries, that's a lot of people, have Medicare Advantage. And if you look at the graph here that comes from the Kaiser Family Foundation, you will see that over time how Medicare Advantage has grown, and now as of 2023 has gotten to the point of 50% of Medicare beneficiaries, and more than likely will continue to grow higher and higher. If you look at the next graph, going back to 2005 when Medicare Advantage plans and Medicare prescription plans first came out, you will see how each one has fared. So the red line is 2023. So if you look at sort of the light green aqua color line, that's original Medicare and how many lives are on original Medicare only. And that has been trending down. The dark blue line is Medicare supplement, and it has trended up, but not a lot, and has actually started to trend down. And this is kind of surprising because since 2005, this is when we've had all these baby boomers born from 1946 to 1964, which I am one of, that have been turning 65 and getting on Medicare. You would think that the supplements would be rising much faster than they are, but they're not. But on the other hand, on the green line, we see Medicare Advantage and how much that has gone up. 37% of the people have original Medicare plus either nothing at all, which is surprising. There's still a fair amount of people that all they have is original Medicare. Not the wisest thing in the world. Or some may have Medicaid. Some could be on employer or group retirement insurance. And of course, we have some people that are on TRICARE. But only about 23% of the people have original Medicare plus a supplement. If you look at a couple of these tables, you'll see here under the total enrollment on that row there, all Medicare beneficiaries are 65 million. About 14 million have Medicare supplements, and when this came out, about 30 million or so had Medicare Advantage. Medicare Advantage, of course, is now equal the number of people that are just on original Medicare. If we look at the next table, and we kind of see from 2011 through 2022, we see the growth of Medicare supplements and how it just slowly trended upwards. But then in 2021, 2022, it started going down a little bit. Now we see that on the next table as well, whereas we see on the left-hand side under Medicare Advantage, we see growth rates of 8.4, 7.2, 7.7, 9.1%. Whereas Medicare supplement, during a time, again, where lots of baby boomers, 10,000 people a day are turning 65, 3.2%, 6%, 3.4%, and then the last 3 years, negative 0.4%. This next picture you see here from the Kaiser Family Foundation shows you the Medicare Advantage penetration rate. Anything that pretty much is green, orange, and red is going to be predominantly Medicare Advantage. Anything that is light blue to dark blue is going to be predominantly Medicare supplement. So you kind of see the areas. You see kind of the central, the northern plains where more people have supplements. And there's the main reason why that is there's just not as many Medicare Advantage plans. There's just not as many providers. And that's a big part of it, where they can have good networks. So why the disparity? Why do so many people now have Medicare Advantage versus original Medicare plus a supplement, especially when they're turning 65 and they have both options available to them? And number one, in my opinion, is because of aggressive and sometimes misleading marketing. So when Medicare Advantage came around, and granted, there are lots of marketing rules that agents and agencies and insurance companies have to abide by, there has been aggressive and sometimes misleading marketing. You're familiar with the ads that you see on TV, flyers that you get in the mail. You don't see this with Medicare supplements. You may get a flyer when you're turning 65 for a Medicare supplement, but after that, that's about it, because there's no guaranteed right that you have after 65 and a half or 6 months after your Part B has started. So you see a lot of advertising for Medicare Advantage. And the reason why that is Medicare Advantage plans are subsidized by the government, whereas Medicare supplements are not. Number two reason why the disparity is because of the no or low premiums with extra benefits that you get with Medicare Advantage that you don't get with a Medicare supplement. Let's go to the Medicare.gov website and take a look what it says here. It says, with a Medicare Advantage plan, you may have coverage for things original Medicare doesn't cover, like fitness programs, gym memberships or discounts, and some vision, hearing, and dental services like routine checkups or cleanings. Plans can also cover even more benefits. For example, some plans may offer coverage for services like transportations to doctor visits, over-the-counter drugs that Part D doesn't cover, and services that promote your health and wellness. Check with the plan before you enroll to see what benefits it offers, if you might qualify, and if there are any limitations. If we go to the Medicare and U book towards the beginning of the book, when it talks about Medicare Advantage, it says you may pay the monthly Part B premium, and you may also have to pay the plan's premium. Some plans may have zero premium and may help pay all or part of your Part B premium. That's called Part B give back. The ads that you see on TV where you can get money back into your check. That's what they're talking about. Those are rare. They do exist, but they are rare. Most plans include Medicare Part D drug coverage. We go back to the Medicare.gov website, and it says right there, some plans will help pay all or part of your Part B premium, but this isn't available in all areas. Very important. This is sometimes called a Medicare Part B premium reduction. That's one reason why. Supplements, you have a premium. They go up every single year because you go up in age every year. You have healthcare inflation. Medicare Advantage, again, no or low premiums. Number three, Medicare Advantage is managed care, regardless of whether it's an HMO or not, and it is more hands-on. Some people love it, some people don't. But Medicare Advantage, more than likely, you will have access to nurses, sometimes 24 hours a day, 7 days a week. You may have nurses that call upon you and visit and check in on you, especially if you have health issues, chronic conditions, you've just been discharged from a hospital or a skilled nursing facility. You could have access to personal care management that you don't get with original Medicare, where you could have a personal care manager plus a care team that typically includes your primary care doctor. You could get house calls, virtual visits, in-home health and well-being assessments that you don't get with original Medicare. And this has come in handy for a number of people with chronic conditions. You will get preventative services reminders. Original Medicare is not going to call you up and say, hey, have you done your mammogram? Have you got your flu shot? Whereas the insurance company that has the Medicare Advantage plan, there's a good chance they're going to call you or send you a notification saying, hey, have you done your mammogram? Have you got your cancer screening? Have you done your flu shot? And so on. And these things come in handy. I've heard stories of people that have been called by the Medicare Advantage company. The nurse called them and say, hey, you're due for a mammogram. And the person wasn't even thinking about going to get the mammogram. And lo and behold, they go get the mammogram. And what do they find? They find cancer that they found it early and they saved somebody's lives. Original Medicare is not going to call you and tell you to get your mammogram. So let's look at customer satisfaction comparison between the two. So we've seen the disparity, why so many people have Medicare Advantage over Medicare Supplement. Now let's take a look at customer satisfaction. So when it comes to Medicare supplements, we will see that about 80 to 94% of the people are somewhat or extremely satisfied, the vast majority being extremely satisfied. Take a look at the chart here. You'll see even original Medicare, 79% of the people are extremely satisfied with original Medicare. On a Medicare supplement, 80% are extremely satisfied. 14% are satisfied. Our next chart down here kind of gives us a breakdown of how satisfied they are. If you look at the bottom, the number one reason why they're dissatisfied is the premium that they have to pay and the fact that it keeps going up every single year, and sometimes it can jump a lot. Now, if you're on a Medicare supplement, you've had it probably somewhere between 4 and 5 years. You've had premium increases. And if you're in relatively good health, if you'd like to see if you can get a lower priced Medicare supplement with the same coverage or close to the same coverage, then by all means reach out to me and let's see what we can do. Here's an article. This is from AHIP, okay? It says seniors report high levels of satisfaction with the financial protection and access to high quality health care that comes with their Medigap coverage. Medigap, Medicare supplement, is the same thing. So Medicare Advantage, let's take a look at Medicare Advantage. 88 to 98% of people that have Medicare Advantage are satisfied. Forbes, 88% of Medicare Advantage enrollees are happy with their health insurance, new study shows. It goes on to say, in the sometimes bleak landscape of American health insurance coverage, which 71% of Americans rate as fair or poor, there may be a bright spot, and that is Medicare Advantage. It says, among people who have purchased a Medicare Advantage plan through eHealth's website, now take that with a grain of salt. My advice is don't go there. 88% were very or somewhat satisfied with their coverage, and just 6% were dissatisfied. Through the Better Medicare Alliance, Medicare Advantage is delivering value and cost savings for beneficiaries and taxpayers. Successful and growing program is delivering value to beneficiaries and the government while driving improvements in quality and patient outcomes. High beneficiary satisfaction. It goes on to say Medicare Advantage beneficiaries also report high healthcare satisfaction and access, particularly as it relates to access to care, having a usual source of care, ease of seeing their primary care physician, and overall satisfaction with the quality of care. A December 2021 Morning Consult poll found that Medicare Advantage has an overall 94% customer satisfaction rate. It goes on. Medicare Advantage delivers better value to the federal government. It says here an actuarial analysis by the Milliman found that Medicare Advantage provides $32.5 billion in additional value to beneficiaries and the federal government by redeploying savings by providing Medicare covered services for less. In addition, Medicare Advantage continues to provide superior outcomes to beneficiaries in comparison to Medicare fee-for-service. For example, that's original Medicare. We're just comparing Medicare Advantage now with original Medicare and satisfaction. Medicare Advantage beneficiaries experience a 43% lower rate of avoidable hospitalizations for any condition and 20% higher rate of seeing a physician within 14 days of hospital discharge compared to Medicare fee-for-service. Again, the reason why this is because when you're discharged, you're probably going to have somebody follow up with you to make sure that everything is okay. Take a look at this from Blue Cross Blue Shield. Now, Blue Cross Blue Shield sells about every type of health insurance under the sun. Major medical, group medical, Medicare Advantage, drug plans, and of course, Medicare supplements. So they have an article here, 6 reasons seniors are increasingly choosing Medicare Advantage. Nearly half, again, of all Medicare beneficiaries are enrolled in Medicare Advantage, a popular program that provides affordable, coordinated patient care and offers additional benefits that addresses social needs, such as meal support and transportation. It goes on to say, and it gives us the 6 reasons Medicare Advantage beneficiaries are extremely satisfied with their health care. They have 98% of beneficiaries say they are satisfied with their Medicare Advantage plan, and 97% express satisfaction with their network of physicians, hospitals, and specialists. So a lot of talk out there you see about how bad Medicare Advantage is or how people don't like it. Well, these surveys and these studies are telling a different story. Now, I'm not pushing Medicare Advantage at all. I offer both Medicare Advantage and Medicare supplements, and it really comes down to you, and we will get to that at the end. Medicare Advantage plans outperform traditional fee-for-service Medicare on a variety of quality measures. Medicare Advantage drives down out-of-pocket health care costs for beneficiaries. Medicare Advantage offers traditional Medicare benefits and more at a lower cost to beneficiaries. Number 5, Medicare Advantage plans offer benefits to support beneficiaries before they experience a major health event. That's because they're calling you to remind you to do all your services. And Medicare Advantage plans often include supplemental benefits not included in traditional fee-for-service. And again, in 2022, 98% of individual Medicare Advantage plans included eye exam, eyeglass coverage, and so on. Health Payer Intelligence says Medicare Advantage member satisfaction soars, mental health coverage lags. So it's giving you a positive, on how the satisfaction soars, but under mental health, it lags. As I believe we're going to get into here, the reason why that is on Medicare Advantage, you don't have as many psychologists and psychiatrists that are in the network as they are with original Medicare that will accept original Medicare. But it goes on to say Medicare Advantage beneficiaries express higher levels of member satisfaction, the same eHealth survey had found. They go on to say member satisfaction is high, prior authorization denials are low. Medicare Advantage member satisfaction is widespread, and 77% of beneficiaries had not experienced a prior authorization denial. Goes on, if we check out here, 6 out of 10 enrollees express greater satisfaction with their Medicare Advantage covered than their Medigap policies. A quarter of respondents were equally satisfied between Medicare Advantage and supplements. So somebody that had a supplement before got Medicare Advantage, 25% were equally satisfied, but 6 out of 10 of them had greater satisfaction with their Medicare Advantage plan compared to their supplement. I'll give you a real world example. A number of years ago, went to see some folks. They both had a Medicare supplement plan. Their neighbors and some friends had Medicare Advantage, had told them how wonderful it was. I went over everything with them, explained the benefits, and they decided to switch to Medicare Advantage for not saving a whole lot of money. It was not that dramatic. What they were paying in premium on the supplement versus that premium that was on that Medicare Advantage was not that much. But they wanted the Medicare Advantage. So I enrolled them in the Medicare Advantage plan. And almost every year I check in on them. Last time I saw them, I was at the neighbor just last fall, and I happened to see the wife outside. I went over there and talked to her, and she just tells me how much she loves her Medicare Advantage plan. Coalition for Medicare Choices. Survey says senior voters want federal government to protect Medicare Advantage. 93% of seniors are satisfied with their Medicare Advantage plan. And then we got a little chart there that they've put out. It says 60% of senior voters are very satisfied with their Medicare Advantage. 9 in 10 senior voters with Medicare Advantage report they are satisfied with their drug coverage. 9 in 10 senior voters with Medicare Advantage report they are satisfied with their preventative services like screenings, vaccines, and testing. And 96% of senior voters with Medicare Advantage would recommend it to their family and friends. So, conclusion. Let's come to some conclusions. So the Kaiser Family Foundation, what they did is they reviewed 62 studies. A review of 62 studies finds few big differences between traditional Medicare and Medicare Advantage on a variety of measures. They go on to say most studies found that utilization of home health services and post-acute skilled nursing or inpatient rehabilitation facility care was lower among Medicare Advantage enrollees and traditional Medicare beneficiaries, but were inconclusive as to whether that was associated with better or worse outcomes. So that's one of the things where a Medicare, original Medicare and a supplement is going to be better is when you're dealing with skilled nursing. Traditional Medicare outperformed Medicare Advantage on measures such as receiving care at the highest rated hospitals for cancer care or in the highest quality skilled nursing facilities and home health agencies. As I pointed out in another one of my videos, if you were talking about a specialty hospital like a Johns Hopkins, possibly a Cleveland Clinic, certainly the Mayo Clinic. If you're at the Mayo Clinic and you need to go there and you got an HMO, forget it. It's just not going to work. If you're on a PPO, it's going to be hit and miss. And so under original Medicare, it's not going to be a problem with any of those. In other areas, though, findings were mixed and showed little difference between Medicare Advantage and traditional Medicare based on multiple studies. So, should you be overly concerned and afraid of Medicare Advantage? Yes, if you don't understand how they work and you enroll through some 800 number or online yourself and have no clue what in the world you got. You go to a doctor and hospital a lot and you picked a plan with a high maximum out of pocket and you don't have Medicaid or financial assistance from the hospital, then you might be a bit concerned with Medicare Advantage. You believe you will need skilled nursing care for a prolonged period. Medicare Advantage is more likely to deny your claim for extended stays, or if you see as I've alluded to, a psychiatrist or psychologist, then might be better off on original Medicare. It really just depends on where you live, the plan you're in, and that's available to you, and the providers that deal with mental health in your area. Should you be overly concerned and afraid of Medicare Advantage? No. When you understand how Medicare Advantage works, along with its pros and cons compared to original Medicare and a supplement, You've made sure you have good drug coverage on your Medicare Advantage plan. You've made sure, which is what we check when you talk with me and we go through the enrollment process. I always check to make sure your doctors are in network, ask you the important questions. We review your medications. So you'll make sure it's not an issue if your doctors in important hospitals are in network or they accept your Medicare Advantage plan. And you've done your due diligence to make a wise and confident decision, and you've carefully weighed all your options. People that call these 800 numbers on the phone or the flyer in the mail, odds of them carefully weighing their options are slim to none. Okay, let's talk about possible regrets. So, one regret would be going from a Medicare supplement to a Medicare Advantage with a high maximum out of pocket. And within a very short period of time, you come down with a serious health issue, a chronic condition, and all of a sudden you start getting lots of co-payments. I can tell you a couple cases where this is going to likely happen. You unfortunately develop cancer or kidney failure, and you're going in for treatment 2 or 3 days a week, and you're having to pay a co-payment on that, and those co-payments start going up. Now, if you're in a plan that has a very low maximum out of pocket, that's going to be a good thing. If you're on a plan that has a very high maximum out of pocket, well into the thousands of dollars, and you had a Medicare supplement, granted, you paid a higher premium, but you were paying little to nothing out of pocket, you're not going to be too happy about that. And that does happen. Another regret would be going from Medicare Advantage to a Medicare supplement and incurring escalating premiums and potentially missing out on thousands of dollars of extra benefits. So you have a Medicare Advantage, you decide to switch to a Medicare supplement. Maybe your premium starts at a reasonable rate, but over time, 4 or 5 years, it's double. And yes, it can double in 4 or 5 years. I see it happen a lot. Now, if you're in good health, you come back around and try to get the same thing for less money 4 or 5 years down the road. But that could be a regret that somebody has. They could say, well, gee, I had a no premium Medicare Advantage plan. Now all of a sudden I'm paying a couple $100 or $300 a month for a Medicare supplement, and I'm not getting all the extra benefits. That could be a regret. So what it really comes down to when trying to choose between Medicare Advantage and Medicare supplement, what we've seen is pretty much they both have about the same overall customer satisfaction. So what it really comes down to is your health. How is your overall health? If you're in excellent health, then you may be more suited for Medicare Advantage. If you're not, and you especially have access to a supplement, if you're not in good health, then you may be better suited for a Medicare supplement policy. Your finances. Some people just flat out cannot afford a premium on a Medicare supplement. And your philosophy. Okay. Are you willing to pay a lower premium with the chance of paying co-payments? Are you willing to do that? Or are you a more cautious, conservative person? I'd rather just pay the premium and be done and pay very little out of pocket. Everybody's different. There's no right plan for everybody, despite what some people say. So what should you do? If you currently have a Medicare supplement, find out if you can get a lower rate for the same plan or consider a lower benefit plan. Example, if you have a plan F, consider switching to a plan G or a plan N. If you have a plan G, consider an N or possibly a high deductible G. If you have moderate to serious health issues, it will be difficult to obtain a new lower premium supplement. You can contact me for a quote. When the annual election period arrives from October 5th to December 7th, carefully consider and review Medicare Advantage plans. Note, you have a 12-month trial period from the time you first get a Medicare Advantage plan coming off a supplement where you can go back to a Medicare supplement guaranteed. So what should you do? If you have a Medicare Advantage plan right now, contact me during the annual election period, again from October 15th to December 7th, to review your current plan and compare it to other Medicare Advantage plans for the coming year and Medicare supplements. Note, if you are currently on Medicaid or you have extra help / low-income subsidy from Social Security, then you can make a change each quarter. So if you want to review now, if you're on Medicaid, have extra help, you can make a change on a quarterly basis. If you've recently switched from a Medicare supplement plan to a Medicare Advantage plan for the first time and you're within your 12-month trial period and you want to switch back, contact me to find out how to go about this. Only contact me if you're from one of the states that I am licensed in. If you have questions, if you need help, go to my website. Lots of information. A couple places on there you can contact me from. You can call the phone number that you see listed on there. The states that I am currently licensed in: Virginia, North Carolina, South Carolina, Florida, and Tennessee, with more states coming soon. And here's where you can help me out, hopefully. Whatever state that you're watching from, if you could just put it down in the comments section, I would really appreciate it. If you like the content, please like it. If you want more content, please subscribe. Okay, just click the subscribe button and you'll get the future content. You'll get the notifications about that. And who do you know that might benefit from this information that's trying to decide, hey, Medicare Advantage, Medicare Supplement, what really is the customer satisfaction between the two? Then by all means, share that with them. So I hope that was helpful to have a real look at the studies that show the customer satisfaction rates of both Medicare Supplements and Medicare Advantage. My conclusion is if somebody has a Medicare Supplement, they're very happy with it. If they have a Medicare Advantage plan, most people are very happy with it. Does that mean you should get one or the other? No, but you should do your due diligence and understand how both of them work and review both of them. And if you need help with that, if you lived in one of those states, I would be more than happy to do it and honored to do it for you. Again, my name is Chris Prang. I'm the Medicare analyst. Make it a great day.